So you mentioned, just as a follow-up, you mentioned JAK kinase inhibitors. So IBD patients may be familiar with one, Xeljanz or tofacitinib. Does that mean that that drug may be safer in IBD patients who get COVID?
Yeah, good question. So inhibiting the inhibitors that are being used, or immune modulators, are not generally being tested earlier in disease when ramping up the immune response might actually be a good thing to inhibit the virus. And so it's all about timing with some of these things. You want some inflammation, some ramp up of your immune system, but maybe not as much at the beginning as you want just at the 5 to 7 day mark. And so that's where most of the trials are concentrating. So are you protected if you're already on one from getting very severe disease? We don't know the answer yet. And we certainly, to your point, there may be some risk with some of the JAK kinase inhibitors of actually developing slightly moderate disease if you're already on them beforehand. So that's a little confusing. If you're already on them, you might be more at risk of progressing, but if you only start to get a JAK kinase inhibitor later after your infection, it might be a benefit. So very, very challenging to tell at this point.